When reviewing the first video, I found a few more than 6 errors, but I think the main ones were the fact that the nurse did not introduce herself to the patient, which is the first thing that she should have done. She didn't wear the mask that she was supposed to be wearing throughout the video. She didn't ID the patient. She should have checked the armband and made sure that the name and date of birth matched her records. She didn't ask about allergies. She didn't ask the patient when he took his meds last. She did ask if he took meds and what the meds were, but I think it's important for her to have asked that question as well. She didn't ask him about the pain he was experiencing. He kept saying that he was having pain, but she didn't ask about the quality of the pain, the location of the pain. She didn't ask him to rate the pain on a scale of 0 to 10. Those things were all very important. And she didn't ask him about his urination. She did ask about his bowel movements, but she didn't ask when he had last urinated or if he had any pain with urination. And those things are kind of important as well, especially in this patient's case. In the second video, the nurse is doing a physical assessment. The first thing I noticed was that the nurse was not wearing her mask or gloves, and she did not wash her hands again. She didn't try to use another blood pressure cuff whenever the first one she tried to use wasn't working, which is something she should have done. She should have gotten another one and tried again. She didn't listen very thoroughly to the lung sounds or the heart sounds. She just put the stethoscope on either side of the chest and then said that it sounded okay. When looking at the abdomen, especially since this is where the patient is having the pain, she should have first inspected it and then auscultated it and then palpated it. Instead, she started off with palpating, and that would mess things up as far as listening to the bowel sounds and that sort of thing. Another thing as far as safety goes, she left the patient's side rail down, and this led to him almost falling out of the bed. It's very important, especially when you're going from one side of the bed to the other, to put the side rail back up. When she couldn't get the temperature due to not having the probe, she shouldn't have simply just put her hand on the patient's forehead and guessed a temperature. She should have found more probes to use so that she could get an accurate reading for that. And she should have also done a more thorough assessment of the kidneys, especially since this is the area where the patient was having the majority of the pain. She didn't even really do the assessment on his back the way that it should have been done. And when she auscultated, she didn't auscultate the vowel sounds in the correct order. She should have started in the lower right quadrant and made her way up and then over and back down. And then finally, as far as safety goes, she didn't put the side rail back up again before leaving, and she should have given the patient the call bell in case he needed something. When looking over the diagnostics for this video, the things that stood out to me were the high blood pressure, the high heart rate, the higher respiratory rate of 24, the red blood cell count was elevated, the white blood cell count was elevated, and the bilirubin was also elevated. So this led me to believe that there was something going on, possibly a kidney infection or kidney stones. That's mainly because of the flank pain that he was having in his back, as well as that elevated white blood cell count. Additional diagnostics that I feel should have been ordered would be a urinalysis and an ultrasound of the abdomen, just to see kind of what's going on in there. Possibly even a GFR to test the kidney function. So in video 4, we're looking at the medication administration process. The nurse, again, wasn't wearing the mask and gloves and didn't do the hand hygiene. In the video prior, she was wearing the mask, but she didn't have it on properly for part of the video, so if it's not going to be worn the right way, then she might as well not wear it at all if it's going to be down on her chin. The call bell should have been within reach. especially since she walked into the room and found the patient almost falling out of bed trying to reach it. And simply saying, "I'm going to come check on you," isn't really enough. In this case, he should be able to get a hold of her whenever he needs to. And the side rail should have been up so that he didn't have that safety risk of falling out. She wasn't very gentle with the patient, which is something that bothered me, especially when putting him back in bed. And there were just a few different areas in which I felt she should have been a little kinder, maybe less, aggressive. Maybe she had more patients to see and didn't have a lot of time, but I feel that she should have given him the attention that he needed. Whenever he asked about his blood pressure, it was elevated, and instead of giving him the opportunity to have some education on his hypertension, she kind of just brushed it off and said, "Oh, it's fine, it's not a big deal." But I feel like this could have been a teaching point for him to, maybe learn how to lower his blood pressure or keep that under control a little better. So whenever it comes to the medication rights, the first one would be the right medication. In this case, it wasn't the right medication because the nurse did not ask the patient about his allergies, nor did she check his chart to see if he had any allergies, which ultimately led to the outcome that comes in the next video. She didn't ID the patient, so she doesn't know if it's the right patient. She didn't check his armband. She didn't check the chart. So she wouldn't have any way to know if the right medication was going to the right patient. And then, since she didn't look at the chart, she doesn't know if it's the right dosage or the right route. She didn't look at the order before giving the medication. She just gave it. And as far as the right time, she didn't really document the time that she gave the med. She just gave it and then left the room. So as far as I know, the documentation was not done for that medication. As far as the right reason, she didn't really do a very thorough assessment, so we don't know if this med is given for the right reason. She didn't ask what the pain level was. She just made it up herself. So I feel like that should have been something that should have been asked before the pain medication was administered, and that way once it was given and she checked on him a little later, she could have reevaluated that to see if it was being effective for his pain. And then the right assessment data was not retrieved at all. She didn't get an accurate reading for the temperature, and she didn't thoroughly check his pulse rate. And the documentation, she made up a lot of the assessment information, and again, she didn't thoroughly document the things that she did. The biggest thing, I think, is the fact that she didn't stay with the patient to see if he had the right response to this medication. She didn't even stay with him for him to take the medication, which is a big deal. She should have stayed to watch him take it to make sure that he actually swallowed it, and then stay with him a little longer, at least came back to check a lot earlier than 3 hours to see if everything was going well with him. Finally, for the last video, again, she's not wearing a mask or gloves when she's doing what she's doing in his room, which is something she should have been doing all along. The first thing I noticed is that she wasn't really keeping the patient's information confidential. We're not really sure who she's talking to in the beginning, but you can kind of tell that she's talking about the patient to another nurse, which is a breach of confidentiality, and that's not an okay thing to do. Obviously, the major thing is that she missed his codeine allergy. She should have, number one, asked about allergies, and number two, she should have checked the chart before what happened. It should have been something that, one of the first questions that she should have asked. She missed the fact that he was having trouble breathing because she didn't check on him for 3 hours and he didn't have a call bell. She missed the fact that he was a DNR, and even if he hadn't been a DNR, she didn't go through the steps the way she should have when she noticed that he wasn't breathing and didn't have a pulse rate. She should have called a code blue rather than, getting the cart and saying, "You guys need to come help." She didn't really go about that the right way. And she should have listened for breathing and checked his pulse rate a little longer before deciding to do that. I don't think that she really thoroughly checked that first. And the last thing I put, I don't really know. I mean, in my opinion, she should have tried to put the head of the bed up a little quicker, given the fact that he was having trouble breathing. But ultimately, you know, he died in the end, so it wasn't really something that she could have prevented by putting the head of the bed up. But that should have been one of the first things that she should do when a patient's having trouble breathing.